to Shri Medical College. Today we will explore physiotherapy for children, helping them stay active and healthy. Physiotherapists that operate in the field of pediatrics give support and therapeutic services to the pediatric population. They understand fully that youngsters are quite different from grown-ups. These health professionals have a thorough understanding of typical child development and how this ties to body systems and functions. Physiotherapy helps young children improve lung function, motor control, muscle strength, and physical endurance. Pediatric physiotherapists employ generic physiotherapy skills and training in development and growth to treat infants through adolescence. Pediatric physiotherapists are professionals in the examination, identification, diagnosis, and treatment of anomalies of movement and physiological issues. They treat youngsters, infants up till the age of 19 years, in the areas of orthopedics, congenital abnormalities, neurology, neuropsychiatry, breathing and prematurity. This includes developmental delay, neuromotor and/or neuromotor problems. Domains of therapy can include in hospital, rehabilitation facilities, outpatient clinics, and within the home setting. Physiotherapy treatment is broad and extensive and can proceed along the life of the child as the youngster grows. The needs of the child alter as they grow, and so does the therapy strategy. A physiotherapist must visit a child's home, school, or community to make or recommend improvements to the community or treatment plan to maximize daily living activities independence. Pediatric physiotherapists have particular expertise in the assessment, identification, diagnosis of, and treatment of child development and mobility difficulties. We use our advanced manual skills as pediatric therapists, along with a healthy dose of humor, creativity, and playfulness, to construct unique treatment plans for each of our patients. The therapy programs aim to improve each child's health, well-being, and capacities so they can move and participate in everyday activities like playing, learning, and attending school. Children with developmental difficulties may have difficulty completing his/her developmental goals by a period or age that is predicted. Developmental milestones are tasks most children acquire or develop that commonly arise in certain age groups. For example, head control, rolling, crawling, walking, and speech. Physiotherapy helps children with neurological or developmental problems reach their full potential, for example rolling, crawling, and walking. Children, infants to teenagers, are treated by a pediatric physiotherapist. Pediatric physiotherapists possess particular knowledge and training relevant to growth and development, symptoms as well as diagnosis within the pediatric field. A pediatric physiotherapist is competent to examine, identify, diagnose and treat physiological problems within the pediatric population. Neurological illnesses can be a result of issues in the brain, spinal cord, or peripheral nerves. Babies and/or children with neurological abnormalities may have difficulty with their physical functions including mobility, muscle strength, range of movement, and balance. Pediatric physiotherapy focuses on hands-on approaches, exercises, and interventions to improve tone, strength, coordination, balance, posture, mobility, and range of motion. Treatment is always performed with the ICF model in mind so that activity constraints and participation are addressed. Goals of treatment focus on components of the International Classification of Functioning, Disability and Health, ICF, in particular that of participation and activity performance. This is done through treating pain management, building strength and endurance, as well as giving the learning opportunities needed for skill advancement. Following the family-centered intervention and early diagnosis model, A pediatric physiotherapist will work in a team in order to treat a child. This team will consist the family, as well as additional health experts. These professions may include a pediatrician, neurologist, nurse, occupational therapist, psychologist, play therapist, pharmacist, nutritionist, teachers, etc. B.VoC strategy is a neurodevelopmental treatment designed to improve developmental sequences, suppress aberrant patterns, and facilitate normal postural control. Infants with cerebral palsy can benefit from motor learning therapy. The Margaret Rue technique uses superficial and deep stimulation and consists of manipulations for activation or inhibition of motor activity. Normal motion patterns are triggered by a series of developmental steps in the Temple-Fay method. The Dormant-Electo technique activates the dormant central nervous system pathways of the brain by applying consistent, recurring movements of patterns of typical sequential developmental movement. As practiced by Kabat-Zinn and M.VoC, the proprioceptive neuromuscular facilitation utilizing functional movement patterns. Urotherapy services rendered by a physical therapist with expertise in the area of incontinence. These therapists concentrate on treating bowel and bladder diseases through pelvic floor muscle training, neuromodulation, lifestyle modifications, and behavioral modification. Pediatric physical therapists work to help children develop to their fullest physical potential. They have specific understanding in the mobility, growth, and conditions that are likely to influence the baby and developing child and treat from 1-day-old babies to adolescents. Some potential forms of treatment include manual manipulation of soft tissues, mobilization, stretching, targeted therapeutic exercises, and postural education. These therapists recognize that children are not simplified replicas of adults and help them reach their full potential through play, positive reinforcement, and teaching. The physiotherapist will work in the child's home, preschool, and recreational settings. Due to the child's and family's complicated needs, the physiotherapist may work alongside medical, nursing, social work, educational, care, psychological, psychiatric, speech and occupational therapists. The physiotherapist working in such teams must be able to communicate his/her observations, assessments, and treatment plans to the child, his parents, and other members of the team. The pediatric physiotherapist must understand infant development, primitive reflex patterns, and pediatric disease and impairment to execute his job properly. Each physiotherapy and child is unique. Your child's physical therapist may employ a variety of treatments and exercises. Your child's needs will determine the blend. Your child's physical therapist will likely keep a record of their abilities, test their progress, and give them home exercises to do between appointments. Your youngster may be more uncomfortable following physical treatment. Normal after-workout soreness is expected. Working weak and fragile regions can be tiring and painful. If your child's suffering is uncommon or severe, consult a therapist. They can ensure certain exercises don't aggravate the injury. Join Shri Ram Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.